TopMedTalk.
Well, welcome to TopMedTalk. I'm Desiree, Chappell, host and managing editor of TopMedTalk, and I am here at the Enhanced Recovery for Cardiac Surgery ERAS Cardiac Training Day put on by Wake Med here in Raleigh, North Carolina. But today we have a special guest, Dr. Kevin Lobdell. He's a professor and director of regional CVT quality education and research at Atrium Health, as well as an advisory board member for the ERAS for Cardiac Society. So, Kevin, thank you so much for sitting down with us.
Thanks for having me. Thank you very much.
Yeah, well, it was really exciting. You were part of the dinner symposium last night and gave a short presentation there and had some really great conversation off the stage with Monty. I thought it went really well. What did you think?
It was wonderful.
Yeah, well, thank you very much. It's something that's really important to us. So we have just a couple minutes before everything wraps up for the day, and I wanted to sit down and just kind of get your opinion and your experience with enhanced recovery for cardiac surgery, as well as just an overview of the ERAS Society in general. So just tell me a little bit about your experience at Atrium. Where is that located?
Their headquarters, Charlotte, North Carolina. It grew from, like many of these systems, a one hospital beginning, and then now with the addition of Navicent in Georgia, we're in North Carolina, South Carolina, and Georgia with about 50 hospitals, of which we have, and the numbers keep changing because we're in the process of merging with Wake Forest as well.
Oh, okay.
So we're somewhere up in the area of $11+ billion a year for an organization, and about 70,000 employees or somewhere in that area. Wow. It's quite a big place. Rich opportunity for us to organize ourselves and use techniques, quality improvement, which are sort of parallel to that of the enhanced recovery, to try to produce something that's very high performing and very reliable for our patients and those people that depend on us. And
your role there is director of those?
Quality education research.
Yeah.
And I've just sort of transitioned in the last year or two. I lose track of time, but my background is in cardiac surgery and in critical care, which I've devoted a lot of my time in the last 15 years to. And then probably the last 10 with a additional responsibility administratively of quality. And I think what we've realized is, like most forward-thinking organizations, we have to think more system level as opposed to just the institution or a facility per se. And that's where I've devoted my time, and I'm fortunate to be able to spend time like that and innovate and help transform the way we deliver care.
Yeah, so how did, obviously, it's being part of the quality, improvement for your organization. ERAS kind of came across your desk, or you'd heard about it before. So tell me a little bit about your journey with that and that of your organization.
Yeah, good question. So I think that when Dan Engelman and some of the others that really thought about ERAS Cardiac and put it together reached out to me, it was a natural fit, obviously, for them and for me, because many of the components are things that I've worked on hard, and I'd like to say that our institution had a role in popularizing. So early extubation, goal-directed therapy, glycemic control, methods to communicate in very reproducible ways, engage patients, are all things that we found fundamental to our success. And so, again, it was a natural fit for us to work on these together. Yeah,
so Monty and I, we were kind of going through the guidelines before and looking at all the different things that we thought, most of us are doing, over half of kind of the guidelines, but it was some of those key points, such as like prehabilitation, that are typical, enhanced recovery, smoking cessation, which we know is really difficult. People say they're doing it, but are they really doing it, kind of thing. So where did you see some of the biggest benefits in the new guidelines that came out, and just from your experience? Because it sounds like you were doing a lot of you're already doing a lot, but where are some of the points that you guys really tried to focus on?
Well, I think one that maybe is a system-level focus for us, but we haven't focused as much in cardiac surgery, would be multimodal analgesia. And so thinking about using neuroaxial analgesia or anesthesia, regional anesthesia, as well as these novel methods to try to reduce the use of opioids has been a challenge for us. And when I say that, opportunity and challenge both, maybe to reinforce some of the things that we've done, but probably more importantly, just reinforce the importance of having a way of doing things, learning from it, and then tackling the next thing.
Yeah, it's just the standardization through the system, I think, is so important. Well, tell me a little bit about the Enhanced Recovery for Cardiac Surgery Society, or the ERACS. Is that how you refer to that?
ERAS Cardiac.
ERAS
yeah,
cardiac,
I think initially it was ERACS, but there was a little bit of a question of that versus ERAS, and subsequently there was this partnership with the ERAS International.
Gotcha.
And
okay.
then ERAS Cardiac being the cardiac component of that. So they're clearly related. Their aims are very much the same. It's been a great opportunity to be able to push some of the perioperative elements of cardiac surgery, which has traditionally had a focus on the intraoperative phase. And it's been very popular for the various societies. An example would be being invited to participate with the STS, or invited to participate with the ATS, or even the European Association. So I think it's shown that these areas are important, they're popular, and it's been very well received. I think alluded to last night that the JAMA Surgery article is one of the most viewed and downloaded manuscripts that has been tracked by Altmetric as well as just JAMA Surgery itself.
Oh, wow. That's fantastic. Yeah. Congratulations on that. That is, that's great. Well, so whenever it comes to doing a little deeper dive in the society that you guys have, so heavy surgeon focused. I mean, you talked about STS. Yeah. So how are you guys reaching out to other organizations? I know I heard Dan last night say, really involving anesthesiologists, but, a lot of people have spoken to the fact that it's a multidisciplinary, collaborative approach to care. How are you guys reaching out and working with other types of organizations, other providers?
I think probably paralleling the touching with STS, ATS, European Association has been things like the Society of Cardiac Anesthesia in addition, but just open door policy, really wanting to be interactive, inclusive of all those different team members that are the face of the care we deliver. So nursing and the APPs and pharmacy, we're really trying to generate as much interest and inclusion as we possibly can, which is probably going to challenge us at some point to define a little better the aims and sort of the structured governance of the society. But at this point, it's been relevant, it's been well received, and that'll be a welcome opportunity and challenge when we get to that point, too.
Yeah, absolutely. Well, just in our last couple of minutes, I asked Dr. Reddy, he sat down with us earlier, what do you see for the future of the ERAS Society, the Cardiac Society? Where do you really see it going, and how does it help? How will it help providers here in the country? And one specific question that I have, I know that's multiple questions there, but one specific is that, whenever I go to these conferences, there people are like, oh, you're talking to academics, but I feel like this society is not just so focused on academics. It seems like you're really talking to everybody. And is that an aim, and is that where you hope to see this kind of go for your organization, or what are you thinking?
Yeah, I think that again, if what we do mirrors the teams that deliver the care, we'll be successful. And then I think that there are probably three big opportunities for us strategically. One is to continually scan the horizon and try to figure out what are those greatest newer opportunities. At the other end of the spectrum, it's probably to take a deeper dive into the things that we think truly are most impactful for our patients. And we've talked about organizing ourselves around some of the work to do that. And probably in the middle of all of that, you hear a lot about implementation and how do we do this back home. That's probably something else we're going to have to institutionalize within ERAS Cardiac to really bring to the people that have interest what they need, what they want, as opposed to, like you say, just an academic approach.
Yeah, the implementation science piece is so huge, and kind of the human factors piece, and I think that's really where all of this enhanced recovery in general is going to. It's like the ideas are great, but
you got to be able to use it.
You got to be able to do something with it.
That's right.
So one of the points that you guys made last night was that most of what you took from the guidelines was all previously kind of published things. And so are you interested in looking at doing, your own research through the ERAC Society, or what is your goal with that?
That is not something that we've contemplated in the traditional sense, but some of what we might do in the name of quality improvement would be look at some of the centers, for instance, that have implemented ERAS cardiac routines and compare them to the norms, if you will, or baseline, say, through the STS database, and see if it's made some of the impact that we think it has. Now, that's somewhat crude, but that is an opportunity to understand if what we're doing is truly of the value that we believe it is.
Yeah, I think that's great. And really that it's going to be, bringing people together and creating more of that collaborative approach and creating the your all's network, and the network of it. So.
Absolutely.
Well, Dr. Lobdell, thank you so much for sitting down with us. I'm glad that we had the experience last night. You did a fantastic job. Loved hearing everything that you were talking about, and the ability to sit down today and have another chat's been great. And hopefully we have more opportunity in the future. I
would love that. What you and Monty have put together with TopMed is terrific. And again, I think I emphasized my interest in the technology from a clinical and administrative standpoint, but you've challenged me to think about this in a new way, and I think it's a real opportunity for us to influence a lot of people that maybe we wouldn't have otherwise, and like we're all interested in, helping our patients. So thanks for all you do.
Well, thank you. I appreciate that. It means a lot.
Thank you.
Thank you.
TopMedTalk.
Desiree Chappell here. Just a quick reminder, subscribe to TopMedTalk. We're a daily source of news and conversation focused on perioperative care. We bring you all the latest talk from all the major conferences in the perioperative space. We can also be found on Twitter, Facebook, LinkedIn, Instagram, and we now have a free mailing list with special offers and additional goodies for subscribers. Go check us out at TopMedTalk.com. That's www.topmedtalk.com.